mood temperaments are risk factors for future mood episodes that can be quite dangerous. Now, regarding the issue, though, whether we should pathologize mood temperaments, having said what I've just said, I'm going to back off and say, I don't know that I'm not saying, and I don't know that that's the right attitude to say that mood temperaments are an illness. I'm not saying they're an illness. I am saying they are biologically and genetically related to an illness. They're part of the spectrum of manic depressive illness, the mildest variety of it. That doesn't mean that you could view them as necessarily a disease. Another example might be you could have very mild hypothyroidism. It's part of the spectrum of thyroid disease. That doesn't mean it's not related to an illness, but you might not say it's an illness if it's really mild, but it is abnormal. And then the question is, what's the relevance of it? Same thing with high cholesterol, high blood pressure. Those aren't actually illnesses. Those are risk factors for an illness, namely stroke and heart attacks in the future. And so we can think of this the same way. Mood temperaments are risk factors for future mood episodes that can be quite dangerous. If you go from hyperthymia and you're always a little high to a severe depression, that's a pretty big fall, and people can get quite suicidal. That does interfere with their lives. They come to clinicians for help. They get misdiagnosed as not having mood temperaments. They get all these other drugs which make them worse or cause more side effects or don't make them much better. But if we diagnose the mood temperaments by treating the mood temperament, it's not the moodiness that really matters, but you get rid of all the other effects which do matter. And the patient's much less anxious, much more able to concentrate, a little happier, and able to live a better quality of life. So we don't have to call that an illness, but it is related to an illness, and it causes other symptoms that people actually are pathologizing correctly, in my view, in psychiatry and calling illnesses.